Welcome, everyone, and thank you for joining us today. I'm Lisa Parker, the VP of Marketing here at Prolific. We're excited to be joined by the SOAR Performance Group to discuss the 4 focus areas helping medical device companies drive better sales results. First, we have a few housekeeping items. If you're wanting to join by phone rather than your computer, please use one of the numbers below as well as the webinar ID. We do have a Q&A window, so if you have any questions during the presentation, please feel free to put those in the window and we'll answer them at the end of the session. If you also have any technical issues, please put it in there and we'll address those during the presentation as well. Once you join, all attendees are on mute. And just as a follow-up, we will be sending out a recording to anybody that registered as well as attended, so you can have the on-demand webcast. Now, let me introduce our speakers. Charlie Thaxton is the president and co-founder of the SOAR Performance Group, a leading sales performance consulting and training firm. SOAR Performance Group helps global sales organizations enable sales best practices to achieve improved business results. Prior to founding SOAR Performance Group, Charlie led high-performance teams that consistently delivered accelerated growth in both revenue and profitability. Bill Green is the Chief Commercial Officer of Prolific. Prolific helps companies create and deliver content and enables sales teams to execute on their go-to-market plans without the headaches. Bill is responsible for leading the global commercialization initiatives of Prolific, including sales, alliances, and marketing to ensure customer success and revenue growth. Bill has more than 20 years of progressive experience in technology solution selling, sales leadership, and global management. Bill joined Prolific from Salesforce, where he held various sales and sales leadership roles in the healthcare and life sciences practice area. There are many challenges and opportunities companies in the medical device industry face. So today, we wanted to spend time delving into the best practices and tips we've heard from our customers on how to drive breakthrough results. And with that, I'll hand it over to Charlie.
So very much for the opportunity to be here today and share some perspective around what we're seeing in terms of the medical device space. And as we look at the medical device space, there are some major changes going on that we're seeing in the marketplace, and the result of some of those changes are difficulty in terms of managing the decision process within medical device companies. So what used to be localized organizations are now becoming more regional, integrated delivery networks, and that's creating new pressures on med device sales teams as they need to look at ways to engage with those accounts. At the same time, account planning, if you go back in time, was typically more focused on a localized particular facility or provider, and in today's world, no longer is that adequate, where you have integrated organizations and they're looking for understanding not only of the local needs, but the overall needs of the organization. And likewise, focus on how do we build buy-in and participation across a team that might be dispersed to have a central focus on the account. And last but not least is interest in improving strategic account planning strategies to drive better results within these key med tech oriented accounts and health providers that organizations are focusing on. Now, as we look at some of these changes and what's creating those changes, one of the things that we're seeing is that the demands on the account teams, these key account teams are forming around the major integrated delivery networks and providers, are actually seeing increased demands on their teams driven by 4 key factors. One is what's happening within the healthcare provider consolidation, and as briefly mentioned, what we're seeing is a lot of movement from individual hospitals to hospital groups, and if you look in your own community, you're probably seeing those changes around you. Likewise, the regulatory landscape. So if you look at some of the ongoing regulatory changes occurring within the healthcare space, creating a focus on patient outcomes and how do we drive better patient outcomes, and the pressures that are driven from those demands, and increasing competition as you see consolidation in the market. There are fewer customers to go after, but that means more med tech companies competing for the same customers. And more importantly, the impact of decisions that are made. So if you look at a major healthcare provider and integrated delivery network, what we see frequently is these decisions are made for multiple year decisions. And so if you're not in that decision and the leader in that decision, you may be locked out for a number of years. And likewise, changing customer expectations. We're going to share some the things that we have seen in terms of those changing expectations. But I was just reading a recent article, Forbes Online, on some trends, and one of the ones specifically mentioned was if you look at what's happening in terms of healthcare providers, they're looking for new pricing models. So moving away from standard pricing to looking at some of the new pricing based on patient pay for performance, based on patient outcomes, looking at population-based risk sharing. And when you consider those types of dynamics that are occurring within the marketplace, a new set of demands on the actual account teams calling on those accounts. And as we consider those demands, the issue is how do we close the gap between the ability to meet those demands and these increasing demands. And one of the key aspects of that is actually understanding where are our people and how do we provide those. We're going to take a minute now and take a look at a poll to get some of your perspective around what you're seeing within your organizations and what are some of the specific changes that you're seeing. So to what degree are the changes in the healthcare industry affecting your account teams? When you consider these changes around healthcare provider consolidation, regulatory landscape, increasing competition, and also the changing customer expectations, to what degree do you see that impacting you? So take a minute and vote, and we'll see what we came up with in terms of the group and how this is affecting our audience that we have here today. So when you look at those changes, Lisa, do we have our poll results back?
Yes, we do. Let me go ahead and share those results.
Great. So it looks like 60% of the group are seeing high impact, some medium, and some low. Will be interesting to hear as we get into our Q&A some of the different perspectives. But I would say for 60% of the audience here, what we're seeing is that these changes are impacting what's happening in terms of your key account teams. Now, when we look at those impacts and changes that are occurring, what we want to do is take just a moment and then reflect on what are some of the changes in terms of occurring in terms of old approaches and new approaches within the marketplace. And as we look at some of those changes, Lisa, could you advance the slides for me, please? Thank you. As we look at some of those changes in the marketplace, what we're seeing in the old world was more of an individual or departmental level decision making. And what's happening in the new world is really a focus on selling at the enterprise level. So no longer can we focus just simply on a particular hospital location. We have to consider all those locations plus the needs of the central organization who may be driving that decision process. The next key change that we're seeing from old approach to new is historically a lot of the decision driven just purely from a clinical decision making. So does the particular piece of medical equipment meet needs of a particular clinical need within a department? But as we look to the future, it's more about clinical plus financial. As a matter of fact, in the same Forbes article that I was reading, one of the things that was mentioned is that the economic value in terms of best value for price paid has risen from 2015 in the last poll they had done around this area, being 53% of the group thinking that was a priority to over 70%. And this was a survey of physicians. And so when you think about some of those changes in terms of not only the clinical view but financial view, that means new requirements. Likewise, in the old world, we had a focus on standard buying processes, and the focus of the past was very much driven. Now, as we see some of these changes, evolving buying processes, particularly when you look at some of the new requests that are being made by the healthcare providers to look at, can we look at opportunities for shared risk? Are there opportunities for patient-based pay for performance? Are there opportunities for population-based risk sharing? And so an evolution in terms of what we're traditionally buying a piece of equipment to now, how do we partner more with an organization from a healthcare perspective? If we look at fee for service and fee in terms of value-based, historically very much a focus on just providing the service, now very much a focus on what are those patient outcomes and how do we drive those proper patient outcomes to deliver the results that the organizations are looking for and help them in terms of meeting their particular scorecard as well. Now, what's required in terms of success? We're going to talk about three pieces of information here. One is kind of key capabilities. So what's required to succeed in this changing environment from the healthcare landscape? What are we seeing in terms of common practice, and what's we seeing in terms of best practice? Now, when we look at key capability, one being the right customers. If you look at identifying who are those key accounts we want to focus on as we see this consolidation in the market, who are our key strategic customers and key customers. One common approach is to look at kind of a segmentation where you look at a quantity of key accounts or strategic accounts. But what we're seeing from a best practice perspective is more of a focus on customer success profiles. So looking at not only the quantitative dimensions of the customer in terms of the potential, but also the qualitative assessment. So what's the relationship we've had in the past? What relationships do we think we can drive? Also looking at the right key account managers. You know, historically, if you think about taking top sellers or people with top relationships into these key accounts, what we're seeing is more of a focus on identifying what are the real competencies we want to drive within the new account management roles, and based on those competencies, building out a success guide associated with those competencies so that everyone understands what's the difference in the new role and the new expectations associated with that role. Likewise, if we look at strategic account messaging, as we look at these individual providers within the healthcare environment, each of these providers has their own strategy, their own focus areas, and disciplines where they're focused. So one of the important aspects of that is to move from what you see frequently to a generic message to more of a differentiated message aligned with a value prop specific to that strategic account. Account planning and execution, if we think about that as a key capability, one of the things we've seen frequently is kind of a history lesson on the account, a lot of static information, but where we want to see the focus is more of a forward-looking view that it's actionable, and it's going to be one of the important things as we hear from Prolific in just a few minutes about how do we take the account plans that we are putting in place and create those actionable account plans by connecting the entire account team together. Likewise, if we look at strategic account management skills, one of the things we've seen is sporadic and ad hoc development of the key account managers, and one of the best practices we're seeing is really a strategic focus on how do we develop our key account managers and build a career path for them that allows them to grow in these key roles with our most important customers. The strategic account business cadence in terms of frequently as people look to drive key account focus, it's moving from a funnel and forecast to more of a focus on integrated account plan and opportunity reviews. So how do we look at our account overall and drive those strategic opportunities within the account? And likewise, if we look at customer engagement program, a lot of what we've seen historically is reactive engagement of executives within accounts, but in terms of a best practice from a key account management, looking at how do we build a structured engagement process for our key executives and ensure those key executives are engaged on an ongoing basis with our key accounts. the strategic account program office, kind of who owns the overall process and supporting infrastructure for a key account program. And frequently what we've seen is there's some unclear ownership, but building that ownership and accountability creates a scalable environment where we can scale around our key accounts. And when you think about the importance of success with these key accounts and being successful with our most important clients, is how do we actually move from this kind of unclear ownership to a more focused and clarity around that ownership. And if we consider strategic account leadership and coaching, one is that it's a change when you start to move to this strategic account focus or key account focus. And how do we move from a sales management focus to more of a coaching cadence that's aligned with the key account process and skills? So being focused on how do we grow the business with the account, build a plan to grow the business, have the skills for our account team to be successful in growing that business and shifting that direction. So what we'd like to do now is get a little more feedback from the group and look at a little bit of which part of strategic account planning and execution process presents the biggest challenges for you. So if you take just a moment and vote, so whether you're looking at which part of the strategic account planning and execution process presents the biggest challenge for you, is it about the right customers, the right account managers, the right account planning process, or the right account planning execution? Take a minute and look forward to seeing what the group comes up with as we consider this. But if you look at all four of these, I would say key important elements to any successful strategic account planning process is, are we focused on the right customers? Likewise, having the right account managers and account team is just as important. And likewise, how do we drive the right planning process and execution against that plan? So it looks like from the group, 67% see the account planning process as being the most important piece in terms of providing the biggest challenge for their organization. So look forward to hearing more about that when we jump into our Q&A. And then second, we see is the right account planning execution. So that's kind of interesting. So it looks like one of the major hurdles is how do we get the plans in place for these key accounts as we look at that. Thanks for sharing that input. And now what I'd like to do is just share with you a framework for thinking about your strategic accounts and how do you build excellence in your strategic accounts in your program. And so if you look at strategic accounts, I wanted to just share with you this framework for thinking about how do you move from where you are, and particularly seeing such a large portion of the group focusing on account planning as being an area where it's a challenge, is if you look at the 1 o'clock position in this particular diagram, you'll see a customer success guide. So central to a key accounts program, strategic accounts program, really is focusing on the right customers. So defining who are the right customers we want to focus on, and then how do we support those customers with the right types of skills in terms of employees. So what's required of the employee in terms of their role in the strategic accounts. And when I say employee success guide, one of the reasons I use that term is that it's not just about the account manager, it's also about the supporting team. So who are the other resources that will be supporting that account executive in their role working with these key strategic accounts. The strategic account message, so ensuring that we've got a message that's targeted specifically to the account that we're focused on, so it delivers in terms of the specific disciplines and focused areas for that client and helps them meet their goals. Likewise, if we look at around the 5 o'clock position, the strategic account planning and execution, so building that plan and executing, and as we saw from the group, over 67% of the group felt like planning was a key hurdle for them, and so certainly once that plan is in place, ensuring proper execution associated with that plan, building the right strategic account skills, looking at how do we build the right business cadence, how do we then engage our executives, the customer executives, within our program, and then connecting them with our executives so we have that executive to executive alignment, understanding what is required from a strategic account program office, having the right supporting tools and process. And then last but not least, we look at the 12 o'clock position is really all about how do we build the strategic account leadership and coaching that we need to drive success through our account managers working with these key strategic customers. Now, what I'd like to do is just say that when you go from plan to execution, that's really where you have an intersection of the plan with the execution. I'd like to turn it over to Bill to share with us some thoughts around going from plan to actual execution.
Great. Thank you, Charlie, Lisa, and for everybody joining us today. My name is Bill Green with Prolific, and I'm responsible for the go-to-market team. I'd like to start by saying I never met an account plan I didn't like, but certainly some much more than others. And as Charlie indicated, there tends to be a gap between the planning and the reality portion of this, and hopefully everybody can resonate with this graphic. I've spent the last almost 25 years in enterprise technology, most recently with Prolific in sales enablement. And so the question that I'd like to address is how can technology complement the people and the strategy and deliver on account planning done right? All right, so if you think about today's reality of selling, and you think about what's in front of sales reps today and what they're faced with, not only is there complexity in selling, given that there's less time with getting access to key buyers, more complexity with buying groups, more competition, dealing with a remote workforce, but there is a mass amount of capabilities at their fingertips, tasks, choices of how to get things done. And as I was preparing for today, it drew me back to the beginning of my career where I started in sales and I had no email, no laptop, no smartphone, and we functioned, with inter-office memos and faxes. And when you left for the day, there was no distractions, no connectivity with work. So it was quite a blissful time, and much more FaceTime with customers, just frankly, because that was the predominant way of selling. And we've really come full circle today from that era of simplicity to mass choice and complexity. And so the challenge in front of reps is when you add account planning on top of this, how can they really break through and see those results? So there's really two constants. One is that change is inevitable, but the other constant is that salespeople, to be successful, have to be relevant, customer-focused, and prepared, and they need to have a great strategy around their territory and accounts, as well as an execution. Account planning is a critical sales motion, as it always will be, and very valuable to do as well. So let's talk about the impact of account planning done right. Only a handful of minutes can make a big impact, or stated differently, a little goes a long way. And we've worked with our customers and prospects to mutually determine this. And this is an example, of an organization with about 500 field reps, right? So probably medium to large. And we took some conservative estimates as far as salary and benefits for the salespeople, contribution margin, and revenue. And just by simply saving 15 minutes a day, right, it makes a big impact on an annual basis of $2.1 million. Now, we're representing here a concept of value of blended cost efficiency, or getting more productivity out of the salespeople, but also the contribution per minute. That's the equivalent of immediately adding 10 productive salespeople to your sales force. So a little goes a long way. So here we've established that the value, we've established value, and that reps have a ton facing them today. And the question becomes, how do salespeople, or how are companies equipping their sales team given how valuable this is. Now, as a sales professional and a leader, I've experienced account planning of all flavors, and some of them were prehistoric. And here you can see kind of a humorous depiction of that. But let's take a look at what these really look like. So I've had account plans that have been manual, disconnected, time-consuming. I'm doing the two-screen shuffle and whiplash between where the data sits and where I've got to represent this so that I can facilitate a meeting. And typically, as Charlie had indicated, these would be history lessons or these epic events of getting a bunch of people in a room and have a bunch of good ideas and tasks, and there'd be the rep that would be responsible for picking up all of those. But without the right capabilities, there's a high propensity of those to fall through the cracks. So let's talk about account planning done right. And to do it right, you really need 4 pieces working together. So we heard from the SOAR group and Charlie about the people and the strategy. And toward the bottom of the circle, I want to talk about enablement and execution. Technology is the enablement piece. This is the day-to-day. And the litmus test that we challenge our customers and prospects to think about is that if a rep had 5 minutes of their choice, what system will they go to knowing with high degree of confidence that it's going to move the needle materially with their book of business? Stated differently, in 5 minutes, what's the system they choose to go and make the most money? And that's the DNA of Prolific. That's what we wake up and challenge ourselves with every day. And on the execution piece, right, this is the task management. This is the collaboration layer of how do you move the organization so it's not some rep emailing different pieces, or they only know where the hidden chamber is of the account planning app. But this is really how we engage the people that can help advance the account planning. So some people call that the collaboration layer, some people call that the task management layer. So I want to give a quick example in my career of the importance of these 4 pieces. I worked for a company, and we had a very well-known account planning and sales methodology put in place. And a new senior VP of sales came in and decreed that any opportunity in the pipeline greater than $100,000 required an account plan. And overnight, 90% of the opportunities greater than 100,000 became 95,000. So clearly there was a disconnect between the perceived value of the account plan and the return that the salespeople saw. So we saw a disconnect there between the strategy, we saw a disconnect there between the enablement and the execution, because as we looked at earlier, account planning is valuable, but if it's incredibly painstaking for the rep, and if it's perceived as not adding value, one of these 4 things is off. So there's going to be twists and turns. We started this, if you recall, with the diagram of plan versus reality. And the challenge is, how can the technology support the dynamic nature and the dynamic requirement of today's account planning? And there's 4 aspects to consider here. One is the concept, starting in the top left, of assignability and accountability. This is running account plans like a project. So in 5 minutes, anybody in the organization that's responsible for contributing and advancing an account plan can quickly go see what they're responsible for and move things forward, right? Not multiple logins and confusion around that. It's just very simple to come in and see, how can I move things forward today? Moving around to flexibility to plan differently. Our experience with our customers is that there's different segments of the market, different structures as far as who's focusing on key accounts, different requirements geographically, different requirements across the brand. And so ensure that the technology and the platform can support those, right? Getting back to user adoption and the enablement. If it's one flavor fits all, but that doesn't really move the needle for everybody, user adoption and the engagement with the account planning technology is going to be at risk. Now, having this managed universal access, this is the idea of acting locally but thinking globally. So how can I, despite having localized experience, for the various selling teams, how can I manage and share best practices? How can I be ensured that I've got a universal collaboration layer or competitive intel layer where I can go and share and learn from my counterparts, and integrate that into my account planning. And then lastly, that these are living and breathing plans. So it's not a static event, it's not a Word document, it's not something that's incredibly difficult for people to access and change. This has to be a collaborative layer. This has to be something that the end user sees value in going in and maintaining. Okay, so now you're at the point of considering technology, and I wanted to share some pro tips based on what we hear from our customers as well. Have a relentless focus on the user experience, right? And so from a due diligence standpoint, really make sure that you understand clearly not only your strategy and your people, but what you're trying to solve, right? And I've talked about this being a platform. Often what we hear is we've got different groups, maybe through acquisition, maybe groups that historically haven't collaborated. We want to bring those people together and have a platform to collaborate around account plans and improve our win rates, as well as task management. And the fact of the matter is, when getting back to the day in the life of the salespeople, that we're mobile, we're home office, we're remote. So we've got to have a great focus on what that experience looks like. When you're considering technology vendors, this is the concept that I refer to as being careful of the menu versus the operation. So many people, many people look at what I call kind of the menu, right? So is the menu appealing? Does it have everything that I want? And in many cases, it has too much. And there's got to be an equal amount of due diligence to look behind the menu, right? What's the kitchen operation, the quality of the food, the staff, how is the place run? But equally important, if you want to change something on the menu, what happens then, right? Because we started this with the plan versus reality. Things will be dynamic. Things will change. Acquisitions will happen. Competition will change. New products will come out. So to the extent that this can keep up with the user feedback, as well as the competitive intel and the changes in your account planning strategy, that will really determine the ongoing value of the account planning technology and the engagement there. Define and measure total cost of ownership and time to value, right? Easy to say, a challenge to do, but it's worth doing it. So, there's a lot of published research that typically 10 to 20% of a technology cost is the upfront licensing, because you've got the implementation, you've got ongoing upgrades, you're going to have changes. And as I've shared with people and I've observed throughout my career, when you've put in phase one and you start receiving user feedback, the time between taking that user feedback and revising it into an enhanced user experience will largely determine the success of your user adoption. If that period is a year, you will lose users and it will become another app that's hidden in the background that's too hard to use, right? If you're able to compress that to days or weeks, that's when you really start to get strong user adoption. Okay, compliance. Ensure, because we're talking about regulated industry and the focus of this is med tech sales, that it is in the DNA of the technology vendor and not a hobby. And then lastly, this is going to be a journey together. And so we talked about just being weary of just looking at the menu, look behind that into the operations. Really do your due diligence and look at, is this somebody that has a long history of partnering with organizations and not moving just software and throwing it over the fence, but really partnering, co-developing, co-innovating, and having a proven track record of being flexible. Okay, so I'd like to wrap up. So the right technology combined with the right strategy and the right people and execution, right back to where we started, can deliver on these four things, which is the focus areas helping medical device companies drive better sales results. And what's even more relevant is that it is incredibly valuable to solve as we looked at the impact. Minutes matter. I want to thank you for your time and interest, and let me turn it back to Lisa for Q&A and wrap up.
Thanks, Bill. We do have a few questions, and I just want to let the attendees know that if you go to your Q&A screen, you can certainly ask the speaker some additional ones, but why don't we go ahead and get started. So, Charlie, this one is for you. It is, as companies look to transition from territory and product line sales models to strategic account model, what do you find is required for success from the organization outside of the sales team?
Lisa, that's a great question. So a couple things, as I understand the question, is as people are moving from territory to account, what's required of the organizations outside of sales? And one of the things that I would say is definitely required is that this starting to think about not just sales, but thinking about the account team. So shifting from a sales focus to an account team focus, and then actively engaging the other team members that need to support that team and having them aligned with the account plan. So helping them become a part of the account team and engaging that broader account team. So I would say engagement from the other departments. And certainly as you look at some of the changes occurring within the healthcare space where there are new business models required, this sometimes might require a reach beyond just the product or solution area, but cooperation with other groups in the company, whether it's finance, service, and looking at how do they have unique delivery approaches for that account. So bringing those other groups in, having a involvement of them in the account planning, and then also ensuring that there's ongoing communication around the account.
Great, thanks. Bill, this next one's for you. How do I get started with an account planning technology? What are some ways to kind of kick that off within my organization?
Thanks, Lisa. I think it's important to note that most software companies are going to want you to buy as much upfront and assume the financial and operational risk, right? And this gets back to my comment about a journey together. So, that's just one thing to understand, how do vendors really tick and what's their proven history of working with people? That's one. Two, and most important, is it's really determined based on what you're trying to solve. So, for example, we see some companies where the most important thing, maybe because of acquisition or it can be a cultural thing, is that they really want to start to just have people collaborate around key accounts, right? There's a knowledge gap between what's in people's heads and some of their high value accounts. So they want to start with a thin and wide approach. And then we see other customers where they've got some real high value accounts and they want to drive user adoption and start to focus and get momentum around the high value accounts. And so they start with a smaller group to demonstrate the value and start momentum there. So in summary, it really is important to define what's most critical to you to start small and to grow.
Great, thanks, Bill. And it looks like we have time for one more question. Charlie, I'm going to go ahead and pass this over to you. What do you see as the implication for account teams as healthcare providers expand the use of alternate pricing models such as pay per performance or risk sharing?
Lisa, that's a great question. I would say one of the key implications is we probably have to think differently about our relationship. So when you look at pay for performance or risk sharing requirements that a healthcare provider may be expecting from a partner, it requires a level of partnering that's probably a big change from just selling a product or service, but more in terms of how do we jointly solve a problem and address that problem together, and then ensure that it's a win-win for both parties. So thinking differently about the relationship, thinking differently about how we partner with these key accounts, and then bringing the right resources to bear to drive that joint strategy that you build with the account so that both can have a win in terms of this risk sharing or pay for performance type of application.
Great, thank you. So with that, I'd really like to thank both Bill and Charlie for the presentation today. Here's some alternative ways that you can get a hold of us. For the SOAR Performance Group, they're offering an in-depth assessment, so a free 1-hour session at the link below. And then for Prolific, if you're ready for enablement, please feel free to contact us. Just as a formality, we will be sending out this information with the call to action as well as the on-demand. We do appreciate your time today, and thank you again so much for joining us today.